So can we? Shida. I thought it's four. That being in that step. You made that man. So let's say. So this one, will be taken by GPRS. Okay. Okay. So because it is going to be after the tea break, I think. Okay, after the tea break. Memos, I'm concluding memos. Okay, sir. She can, maybe I think we should start. Yes. So no. Anybody can. Let's just start. The MC. Can we settle down? Can we settle down? Where is the MC? MC.
Right here, sir. Good morning. Okay, sir. Good morning, sir. Good morning.
Nobody was in the high table and.
Yeah, because they said I should just go ahead.
No.
I was watching based on instruction.
It's now that the chairman has come, so
okay.
We'll take a
maybe this time around we'll take the two stanzas.
National anthem.
You don't want to mess with Scafini. Better than the rest.
More music on trendybeats.com.
Anybody who won't fight you.
Yeah, okay. Please, can we get settled? Maybe have a pin drop silence so that we'll observe again the national anthem, and it is a blunder on our side that we started the national anthem without having the dignitaries seated. We went quickly ahead of time. I sincerely apologize for that. So we'll go over the national anthem again, and this time around we'll take the 2 stanzas of the national anthem. So please, can we get settled down at the back, please?
Please, can we just stand?
Yes. Thank you. Please take your seat. Okay, so we'll run down through the program for today. We would start with the rapporteur for the 2 days, having a review of all that we have been ingesting in the past 2 days. And then we'll continue with the memo. As it was said yesterday, we took a break on some of the memos. So today we will continue, and then we'll go for our tea break. By the time we come back, we will continue on the rest of the program. Thank you. I want to sincerely honor the presence of all the dignitaries here, and I would want to have you take your seats accordingly. I welcome you all to this special day. So I welcome you all to this special day, the 3rd day of the 11th Plateau State Council on Health, with the theme, Repositioning Plateau State Health Systems Towards Achieving the Universal Health Coverage. Today is the last day, and from now I will pass it on to the Honorable Commissioner to welcome us officially for the opening of today's event. Thank you so much.
So thank you very much, distinguished delegates. I hope we all slept well and everybody is active this morning. I welcome especially those that are joining us for the first time. I know there are a few people that today, on the last day, they are coming, and we are glad to have all of you. Like we said yesterday, The MC has already said it. We'll take the remaining memos, and then after that, we do our tea break, and then we come back for the session, for council session. So please don't be tired. We are almost done. We appreciate all of you that have been so committed, coming early for all the sessions and for all your contributions. Let's continue in that spirit. Once again, we are all welcome and happy deliberations for today. Thank you. Clap for me so that I will be happy.
Where is the MC?
Yes, so please, I will invite the rapporteur. Subi, are you here? Okay. Please, you use that microphone. That's better. Please go ahead. Media, please, can we have the rapporteur?
Good morning. Permit me to stand on the existing protocol that was established from day one. My name is Edward Banyula Subi, a team member from the repertoire team. This is an extract from the detailed report of the proceedings of day one and also that of day two yesterday. And the team of the Plateau State Council on Health, repositioning Plateau State health systems toward achieving universal health coverage. The sub-team is strengthening resilience and inclusive health system, improving access to essential medicines, improving maternal and neonatal outcomes in rural Plateau. So the one session, opening session highlights the Honorable Commissioner for Health delivered a welcome address and thanking the governor for reconvening the council, the traditional council after 12 years. And the key highlights include appointing the first-class traditional rulers as health ambassadors in the state, commending the BC, that's the Basic Healthcare Provision Fund implementation from Nigeria, and the Governors Forum and the National Assembly were here in the state to be able to assess the health system in Plateau State, and also the commencement and the launch of ambulance for offering services in the state. From there, the governor, the person of Honorable Caleb Mufwan, reaffirmed his commitment to health coverage, united health coverage, ensuring quality, affordable health care without financial hardship. Some of the achievements that noted in his presentations are expansion of PAC facilities across 17 LGS, 1 per ward, and also the increased plus CHEMA enrollment for vulnerable groups, pregnant women, under 5, elderly, and also the disabled. Strengthening the DCMA for affordable medicines and upgrade at Plateau State Hospital. 22 new consultants and 2 billion naira equipment, electronic medical records were there in Plateau Hospital. And he also pledged to tackle the rural gaps, workforce shortage, and data weakness through recruitment, training, and incentives, stressing collective responsibility among stakeholders. And also goodwill messages was taken from WHO, Bongom Jos, Plateau State House of Assembly, and the Federal Ministry of Health. Yes. So the key highlights, there was a presentation that was taken on day one, And the first presentation is on healthcare needs and crisis-affected population by Professor Jonathan Dabo. Second presentation, please. The second presentation is strengthening resilience and inclusive health system by Dr. Zainat Kabir from WHO. And there are discussions we're taking after the two presentations, and some of the comments we noted here is that Professor Usar noted cultural peculiarities may hinder WHO domestication, emphasized private sector contributory scheme and data-driven system. Dr. Yakubu Dauda Izan questioned NEMA's role in LGA crisis management. The facilitators clarified NEMA and SEMA collaboration based on the magnitude of those crises. The third presentation was taken on cultural beliefs and attitude impacting maternal, neonatal, and child health by Ms. Professor Peter N. Wicker, PhD. And also, there's an in-depth discussion on the first panel of discussion, which was moderated by Professor Chundumaina. The panelists include Dr. Maribon Sonwar, Dr. Madi Musa Wade, Professor James Damen, Dr. Kwande Solomon Dawal, Professor Usar, Professor Noel Wanan. And the key highlight from the panel of discussion, we have identified gaps in healthcare funding, which the gaps is underfunded sector, inadequate sources, government insurance and donors, sustainability, enforce Abuja Declaration, 15% budget expansion, informal insurance and community ownership. The prioritization focus on the PAC equipment and staffing. Innovation. One of the innovations that was highlighted that day is Syntax Health Trust Fund and inclusivity, better data on vulnerable groups, expand, and to also expand plus CHEMA. And we stream online, and we had an online contributor from Dr. Tayo Obindo, which urged that mental health integration in PHC, and also Mr. Adamu Abdullahi advocated for social protection policy. The second panel of discussion talked about human resource for health, which was moderated by pharmacist Lenkad Neyman. Included panelists include Indi Dr. Raymond Jurit, Dr. Bishan, Stephen Polycarp, Dr. Kefas Ibrahim, Professor Moses Chingel, Dr. Bulus Jonathan, Professor Oluwatoyin Ogunyewu. Based on the panel, these are the key highlight: shortage of understaff, training. They suggest to be trained 1,800 trained staff in 2024. And also there's a plan to hire 1,450 staff, skilled birth attendants. Out of those number, 80% should be skilled birth attendant. Retention, poor welfare equipment, insecurity, improved packages, and data that's critical for planning and provide digital tools, technology, training, ICT, e-learning, gender framework to be in place, and emergency PPEs for post-COVID. So participants' comments were reviewed on posting policies, use of telemedicine, rotational visit, immediate recruitment, discourage overseas training, engage traditional leaders, involve LGA chairmen to prioritize vulnerable population. Yes, go down. So, those are the presentations as at day one. So the recap of day two yesterday, which was commenced by national prayer and the welcoming address, emphasized on the significance of the council on the theme addressing contemporary health challenges. So yesterday, good news messages was taken from UNICEF and also PLASU. Professor Moses Galadima represented the Vice Chancellor, which he expressed gratitude for including PLASU into the council, and also he highlighted key health programs that is taking place at the university, nursing and public health, and also the newly accredited MBBS program, which is going to start 2025/2026 session. And the procedure for the technical committee meeting was given by the Honorable Commissioner, the person of Dr. Nicholas Bamlong, as the council chairman, which outlined the procedures for memo presentation by MDAs and private organizations. And the technical committee is comprising of the commissioner himself as the chairman, Dr. Bitrus Osaya as the permanent secretary, Dr. Philip Patrobas, the chairman technical committee, and Professor Chindomaina as the secretary of the technical committee. And 40 memos were reviewed, and out of these 40 memos, 25 plus memos were they scaled through for presentation here. And the memo presentation was grouped from group 1, group of 5. So we have 5 group of memo presentations. And 2 additional memos were taken yesterday, and the 2 are regulation and guidelines for assisted reproductive technology in Plateau State, and also human resource for eye care workers by youth. And the key presentations yesterday were taken. The first presentation is the current status of maternal, newborn and child mortality by Professor Shiwe, and challenges of essential drug supply on the plateau by Mr. Daniel Botts, and conclusion of day 2. Day 2 of the 11th Plateau State Council on Health provided a robust platform for technical discussion with 25 plus memos with 3 key presentations addressed on maternal/child health, drug supply, and eye care. And the session understood the need for data-driven policies, workforce development, and sustainable finances to address inequalities and achieve universal health coverage. Resolutions from the approved memos will be forwarded for final council approval and action by relevant authorities. Thank you, and God bless.
Thank you, Subi, for that powerful presentation of the recap from yesterday and day 1. We will continue with the memo from where we stopped yesterday, I guess, and with the procedure on the conduct of the SCH, which will be conducted by the Honorable Commissioner of Health. Okay, the permanent secretary. Yes, thank you.
Good morning, all. Yesterday we had 2 memos in our booklet. They were not presented. We are going to do the presentation, and we have 2 additional memos, making a total of 4 presentations to be done this morning. The 2 on the booklet we have plus chairman. They will do memo 22 and 23. We now call them for presentation.
They can just be moving it. No. Please, put it on. Mr. Permanent Secretary, sir, I am Dr. Jofa Judenden, the Director of Planning, Research and Statistics plus Chairman, presenting this memo on behalf of the Director General of the Plateau State Contributory Healthcare Management Agency. The title of the memo is Strategic Adoption of the Ghanaian Model of Community-Based Health Insurance as a Catalyst for Achieving Universal Health Coverage in Plateau by 2030. The purpose of this memo, it seeks the endorsement of the Plateau State Council on Health for the strategic adoption and implementation of community health-based insurance as inspired by the Ghanaian experience as a pragmatic and inclusive mechanism to accelerate the attainment of universal health coverage in Plateau State by 2030. So the background, Plus Chema is vested with a mandate to expand access to quality and affordable health care through sustainable social health insurance framework. To date, the agency has done quite a lot with approximately 220,000 enrollees, which represent about less than 5% of the estimated population of Plateau State. So despite all this progress within the formal sector and then the designated vulnerable groups, insurance coverage remains critically low among the informal sector and the rural populations, which collectively constitute majority of the state populace, about 70% of the state populace. Structurally, limitations including irregular incomes, limited awareness, and socio-cultural barriers have impeded the penetration of the contributory schemes into this demography. So the Ghanaian model, particularly in community-driven model, has demonstrated robust success in addressing similar coverage challenges. The Ghanaian model leverage on decentralized governance, grassroots mobilization, flexible payment modalities to facilitate equitable access to healthcare service for the informal and rural poor. At their level, in Ghana, they have a national coverage of about 40%. So what's the justification for this memo? One is to increase coverage in the informal sector. Can you move? To contextualize viability of the Ghanaian model, to enhance trust and uptake. By this, we mean that once you have community involvement, there is an enhanced trust. And then operationalization, decentralization, and flexibility. This will avoid all the bottlenecks. It also aligns with the state and global usage goals. So Plateau State is committed to SGD 3, especially 3.8. And this also gives us a potential for development partner synergy, because there's a lot of partners that are interested in working in this space. So what are our prayers? So we want a policy endorsement that the Plateau State Council on Health formally endorse the adoption of the community-based health insurance model, drawing from the Ghanaian experience as a strategic instrument to expand health insurance coverage in the underserved population. We want a pilot scheme authorization, the approval to be granted for the design and implementation of a pilot community-based health initiative in selected LGAs, based on demographic potentials and readiness for community mobilizations, which already have some of those structures. Stakeholders engagement, because it's very important that the stakeholders buy into this. There's a comprehensive stakeholder engagement plan be developed, encompassing traditional leaders, religious leaders, cooperatives, and community-based organizations to drive awareness, trust, and participatory government, to integrate this into the health financing strategy so that the community-based health insurance be formally integrated into the Plateau State health financing policy. Currently, it's not part of the policy, as a complementary mechanism to the existing contributory schemes with defined targets, rules, and monitoring indicators. We also expect that we should have some, since the Ghanaian model is a very good model, there should be a peer learning visit to Ghana to be able to see what they are doing very well, and then to development partner engagement, that the agency be mandated to explore technical assistance and catalytic funding from relevant partners to support design, piloting, and potential scale-up of the community-based health insurance. Thank you. The next one.
presentation. Let's clap for him. I want us to be reminded of the time for presentation.
Okay. Next one.
Presentation is 3 minutes. The first 2 minutes, you'll be given a warning.
Okay.
Then the last 1 minute is to tell your lead. We have heard of the first presentation by Basema. We'll go to the next one, memo number 23.
Okay, so this is the memo of the plus chairman and entitled Enhancing Healthcare Access and Allocative Efficiency in the Basic Healthcare Provision Fund through targeted community-based house-to-house beneficiary verification and facility-based re-enrollment. The purpose for this memo, the memo seeks the approval for crucial initiative conducting periodic house-to-house verification, update contact details and national identity number names, and reassigning facilities for beneficiaries of BHCPF. By implementing these measures, we will strengthen the accuracy of the beneficiary records, improve financial allocative efficiency, and ultimately increase service utilization among Nigeria's most vulnerable and plateau most vulnerable populations. Actions are expected to yield a credible and verifiable database that supports the targeted health interventions. Can we go to the justification, please? Justification. So, despite ongoing interventions, which include enrollee town meeting, referral coordination meetings, BHCPF beneficiaries in Plateau State appear to have suboptimal utilization with a utilization rate of less than 1 visit per person per quarter. This underutilization not only weakens the health outcomes, but also implies inefficient allocation of poor health interventions. This is because while prospective funding by ways of capitation continues to go to the health facilities, those who need these health services are not using the full spectrum. And as a result of that, we found out there are some things that cause the low utilization, like one, mismatch in facility assignment, lack of awareness. Some people were enrolled and they didn't even know that they were enrolled. There were errors in the enrollment data. There was migration and mortality. Some people have moved from where they were before, and some have already died. Invalid contact information, missing national identity numbers. Can we move, please? Let's move to the prayer. So our prayer is for the council to adopt an annual house-to-house verification of the BHCPL beneficiaries. This will enable this exercise to ensure reliable data, improve financial allocative efficiency, and drive higher service utilization. This is an avenue for assignment of the NIN. You know that this will also help us as a state to achieve the DAY3, because for every enrollment now that they want everybody to have a NIN. Then encourage statewide implementation of the house-to-house verification. We expect that if this works in Plateau State, it should be expanded nationally, which we also seek for the council to allocate to the NIMC, that's National Identity Management Commission, to license state social health insurance agency able to issue NIN to beneficiaries at the point of enrollment. This will help health insurance agencies to enroll beneficiaries that are universally verifiable, thereby improving data credibility. And then we facilitate the sharing of verified data between the SHIAs, the NHIA, and then the State Operation Coordinating Unit, SOCO, to ensure that only verified people are benefits of our social safety nets. Thank you very much.
Please, can we clap for him? Thank you for the presentation. We have two members that are not in the program. We will take the two. After that, we go. Okay. So, the other one, what is it? Okay, sorry, I said we have two. We have four members that are not in the program. So I will call them. The first is the Medical Women's Association of Nigeria, Plateau State, to please come up for their presentation.
The chairman of the council, kindly permit me to stand on existing protocol. My name is Dr. Nana Awaya Meribe. I'm the president of the Medical Women's Association, Plateau State Branch, and I'm here to present a memo titled Adoption of the E-Motive Bundle as a cost-effective innovation to reduce maternal mortality for postpartum hemorrhage in Plateau State. Okay. As we all know, postpartum hemorrhage is high in Nigeria. Maternal mortality is high in Nigeria, and Plateau State is no exception. And this is what informed this particular memo. Let's go. So the E-Motive Bundle is actually an evidence-based, cost-effective bundle by the World Health Organization that is useful in low-resource setting for the prevention of postpartum hemorrhage. As we know, postpartum hemorrhage causes a large chunk of maternal mortality. So the E-Motive quickly is actually an acronym. The E refers to early detection using calibrated drapes for accurate blood loss measurement. The M refers to massage of the uterus, which has been found to be a procedure to stimulate uterine contraction, and the administration of oxytocin, which we know is our first-line uterotonic during managing the third stage of labor. And then the tranexamic acid, which reduces bleeding. Okay. And then IV fluid, and then escalation, when to take decision. So the justification for this proposal is because of the high burden of maternal mortality in Plateau State, and also the cost effectiveness of this particular bundle and its scalability in low resource settings. And based on the evidence that it has been found to reduce postpartum hemorrhage by up to 60% in centers where this trial takes place. Okay. So our prayer is for the adoption of the E-Motive Bundle as a standard first response protocol for postpartum hemorrhage management in all public and private facilities, and also to mandate training programs for all healthcare workers, cutting across board on the E-Motive Bundle, and also incorporation of the E-Motive Bundle into the state's essential medicine list, especially to ensure that oxytocin and tranexamic acid, IV fluids, and these drapes are all available, and also to support monitoring and evaluation through the MPDSR of the state. So we believe this intervention will significantly reduce preventable maternal deaths and position Plateau State as a leader in innovative maternal health care. Thank you so much.
Thank you. Can we clap for her? Our presenters, I think, two important aspects of presentation so that we set time is the purpose and prayers. The next the 3 members that are left, APIN will present 2, and the last but not the least is to be presented by the Honorable Member, House of Assembly, by name Daniel Nambon. So APIN will present 2.
Thank you. The Honorable Commissioner, members of the Technical Committee, members of the Council, ladies and gentlemen, good morning. My name is Victor Ekeke, and I'm here to present the memo entitled Sustainability Reset from Donor Dependence to Durable State-Led Care for HIV Program. The purpose of this menu is to seek Council's approval to set clear state-led direction for sustainable HIV program in Plateau State. And this is in the face of dwindling external funding. And I will also seek that the State Council on Health endorse accelerated domestic ownership, financial reforms, and accountability mechanisms, especially for HIV programming. Honorable Commissioner, it might interest you to know that in Plateau State we have about 46,000 persons who are accessing care, HIV care in Plateau State. And about 1,817 of these are pregnant and breastfeeding mothers. And again, we have 0 to 19 years who are part of this cohort. And every week, we have an average of 40 new positives that are added in the program. All these are funded largely by external donors. And so, for us to foster sustainability in the state, it is important that we plan. And if we are planning without planning for sustainability, then we will not make progress. Our prayer is therefore that Council approve increased domestic allocation through the state budget, and of course plus CHEMA, to position HIV sustainability within Plateau State's universal healthcare agenda, and also to direct the development and adoption of a costed Plateau State HIV sustainability roadmap with clear targets, quarterly reviews, and public reporting system that foster accountability and sustainability. Thank you.
Can we give him a round of applause? Okay, a different person is coming for the presentation of the second memo.
Honorable Commissioner, members of the Technical Committee, members of the Council, ladies and gentlemen, good morning all. My name is Joseph Oguche, and I'm presenting this memo on behalf of APIN Public Health Initiative. The title of this memo is Scaling Up Adolescent Health-Friendly HIV Services and Operation 000 Club, a strategy for improving HIV treatment outcomes among children and adolescents. The purpose of this memo is to seek the State Councils of Health endorsement on the scale-up and sustained support of existing adolescent and youth-friendly program, including OTZ Club across all supported health facilities in the state. A pediatric and adolescent HIV infection remain a public health priority in Plateau State. Children and adolescents contend with stigma, low treatment literacy, inconsistent caregiver involvement, and psychosocial stressors that erode retention and also bluntly the viral load suppression. To consolidate on this gain and close persistent gap, government ownership must now anchor scale up through clear policy direction, predictable financing, and accountability for outcome. The memo is justified because we want to strengthen OTZ implementation, adolescent-friendly service delivery, continuity of treatment and quality of care, capacity building for healthcare workers, data use for improvement, quality, performance culture, and also equity and reach. What are our prayers? Approve the scale-up and sustained support of existing adolescent and youth-friendly programs, including OTZ, across all state health supported facility. Approve a dedicated budget line for adolescent and youth HIV initiative covering OTZ club operation, staff training, and mentor evaluation. Mandate integration of OTZ adolescent-friendly services into state and local government annual operational plan, quarterly KPIs, including IIT, MMD coverage, disclosure, youth HIV coordination decks with LGA focal people to supervise scale-up, standardize tool, and convene monthly data use hurdles. And lastly, direct partners alignment to a single scale-up plan that expand OTZ from 22 facilities to all state-supported ART sites in a phased approach with the next program year with semi-annual progress brief to council. Thank you.
We are going to take our last memo, and it's going to be presented by our honorable member, Honorable Daniel Lambo. Did you say something like this? Okay. Yes, it's already in the district.
Good morning, all. All what I will just say here is that I will just give the preamble, then move to the prayers. The law seeks to establish health management information system, the issue of diseases, genomics, the banking aspect in Plateau State. By the special grace of God, tomorrow we'll conclude it. But our prayer is simply, the state healthcare delivery system requires an advanced, well-regulated structure for the collection and management of health data, diseases, surveillance, and genomic research. The establishment of HMS, diseases and genomic banking, will significantly improve the state capacity to manage public health challenges, respond effectively to diseases outbreak, and foster medical research for improved healthcare outcome. On this note, I humbly call and I humbly solicit that Council should accept, adopt, and support our prayers. Thank you. Thank you.
Honorable Member, thank you for the presentation. I think this is the shortest presentation that has ever been done here. He was never given any warning, but he did the presentation diligently and we got the best out of it. So we have 6 memos that have been presented now. It is now time for questioning, comments, and observation from any of the memos. Do we start with the first 2, or we leave it open? So those that have questions, observation, please can you raise your hand so that I'm seeing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Wow.
Can we take the 11? Can we take the 11? Okay, please let's start from this side. 4 from this side, those that raised up their hands. Okay, let's start from you. We are starting.
Can I start?
Okay.
Okay. Good morning, Permanent Secretarial Protocols duly observed. I want to thank, but I just want to make 2 inputs. First, on the memo on community health insurance, and the other on the memo on sustainability. For the health insurance, I just want to ask the health insurance people whether they have exhaustively looked at, what is in literature concerning community-based health insurance. I don't know whether that's where they mentioned the Ghanaian experience, but widely in literature, it shows that yes, the nomenclature is good, community-based health insurance, but that the output and outcome everywhere it's been practiced has been very poor. One of the reasons is that you want community people to contribute so that they get health insurance. That does not protect the vulnerable, the poor in the community. They don't have anything to contribute. So I would like them to look at literature to see what literature is saying about community-based health insurance. So that's my first input. The second one on sustainability. I think that the presenter aptly put it. We cannot be planning. The talk about sustainability should move beyond just mere talk. We should have concrete evidence that we are thinking about sustainability. Do we have it on the plateau? I am not sure. That's why I stand to support that we make concrete plans for sustainability.
The Permanent Secretary, good morning, sir. I'm Afani Ezekiel by name, the coordinator, Network of People Living with HIV and AIDS in Nigeria, Plateau State Chapter. I stand to support the 2 memos presented by APIN. It is true that people are being infected day by day with HIV in the Plateau. And we are a lot living with HIV and AIDS in the Plateau. It is true if these services will be scaled up to the rural and hard-to-reach areas, definitely because we are moving towards a free HIV generation. And if these services are not moving to the hard-to-reach areas, we will not ascertain that. And what are the causes of HIV transmission in the state? Is the stigma and discrimination, which we advocate for the bill to be passed on the Plateau. And my question goes like this. What is the government doing about sustainability? Thank you.
We're saying the first two speakers are in support of the memos. Okay.
Thank you. I beg to stand on the existing protocol. My name is Domjil Logdip. I'm the chairman of Mascot Society of Nigeria, Plateau State. I want to add my voice to what the other speakers have contributed. By supporting these bills. In fact, the first one, the one supported by, given by, interested in this because he talked about data. And I know that in the health sector, those who keep, the information of our patients are the health information officers. So it takes me back to our memo for yesterday that we presented as a joint memo by the health professionals. I recall that, so I want to plead here that memo of yesterday be amended so that we add, the health information managers, because these are people that keep the records of patients that come to our facilities up initio before they even start any processes. So I think it should be added. And like I said, I'm in support of the memo so far presented to be and discussed and passed if possible. Thank you very much.
Yeah, the commissioner and all other participants that are here. My name is Pharmacist Gyang Samuel Ishaya, the Secretary of Jos North. My own is challenges of hepatitis that is seriously consuming our people in the plateau. If you go to male medical in Jute, if you go to the villages, you will see that a lot of people are suffering in respect of this hepatitis. When you talk about kidney transplant, we have about 190-something indigents of Plateau State that they cannot afford the drugs for that transplant. So for me, I felt that they have been writing letters to the state government to assist them. And most of these transplants, they are living on drugs. It's like lifetime drugs that they are taking. And secondly is that when you consider such kind of people, you kind of showing them love. Because once there is transplant, somebody just feel as if there is the world has ended. So
okay. Now we have passed it. You want? Yeah. Continue from there. We'll come back to you.
Good morning, the Honorable Commissioner, the committee members. I'm Honorable Pam Christopher Darwan, Councillor representing Holshe Ward and Chairman House Committee on Primary Healthcare. I want to give my input on the last two memos. The last two memos are speaking on the same thing. And the contribution that my secretary from Jos North also added. The last two memos should be matched together because they are speaking of the same thing. Then memo 23. Memo 23 is a good one. But we have to consider the people at the crisis areas. There are some factors that are going to hinder the implementation of this memo, which the council need to consider. And these factors are: one, policy of governance. Political will, power, or support can affect this memo implementation. Let's say if we implement this memo and the government that are coming in place maybe next time are from different party, you will discover that the implementation of this memo will be a hindrance. Then two, regulatory body from the bottlenecks. You know that it is politics. Then healthcare are very, very bad memo. Then the last one is health management information. You discover that at the rural areas, there is poor management of health information, which we need to consider as a state. Thank you.
Please let us summarize. We'll be giving 1 minute so that those that raise their hands can make a contribution. There was somebody at the back. See,
all due protocols observed. My name is Dr. Freeman Miri. I want to talk in respect of the chap from Plasima. Beautiful presentation. But you see, and they will now have the impact. But if you don't bring them in, working along with your local, you want to call them, unless you do that, you will never have that. You will never have the uptake more than your 10, 20, or 30%. That's the best you can ever get. But if you scale it downwards, you would be able to move maybe up to 50% or 60%. Thank you.
okay, thank you. Please, can you come here so that we finish with this side?
Very important for us to streamline, for example, diagnostics that are coming into the state in diagnosing communicable diseases. Just like it was mentioned yesterday, we must streamline them and see how we can go about it. So in scaling up our activities, I would just want to strengthen my voice on this to say that we should spread it in a way that the investigations will cover both the communicable diseases around HIV, hepatitis, and so on, and then indeed the program component that they added as NCDs into their framework. Thank you so much.
Okay, thank you. Plasema should take note of the two questions. There are two questions for them to give us an answer. We'll come to this side. We are done with this side.
Thank you. Thank you, Chairman. I would like to comment on the two memos